We are back. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. We're back for talking about getting what you want and what you need out of a 15-minute medical appointment and how to help medical office staff help you, which goes a long way in getting what you want out of these medical appointments. As I always say, you will see me down here occasionally in the corner of the screen. This is where I share stories and information. I'm usually off the camera so that these webinars run smoothly. And let's get started with housekeeping as we always do. I use the term elderly parent or elderly parents for the person for whom you're providing care. The outline for this module is in the course materials. Please print it out. Please also print the slide handouts for each section so that you can make notes as we go through the slides. I do put those dots in the slides so that you're following along with me. Let's talk about the objectives of helping medical office staff help you. At the end of helping medical office staff help you, you should gain insights on how to work with medical office staff, formulate a process to get what you want from the doctor, and develop time-effective communication skills so that you get better medical care for yourself or for an elderly parent. Healthcare providers want to have positive relationships with caregivers and care recipients, but as you know, they are time pressed. It's important to be very polite to reception staff, to people that you speak to on the phone, and to those who try to help you, even though they may not be that person who has the answer. Learn the names of the people in your parent's medical office, even if you have to write them down. Be friendly, acknowledge the work that they do, empathize when they seem busy or flustered. Ask for help rather than demand or be impatient, even if you are feeling impatient. Use humor when at all possible. People are more likely to help you and to go out of their way when you are pleasant and polite. And this is a very important one. In every medical office, and really in any interaction that you have with the medical system, if you can identify the go-to person, and I'll use an example of the workplace. In your workplace, there's usually a person, the go-to person, that you go to that has answers about a complicated situation or a process. It's the same in the healthcare system. In a medical office, there is usually someone there who can correct a billing issue, who can answer a medical appointment, who can talk to you about referrals to other providers. It's very important to know who that person is. It can save you a lot of time and frustration, and it can also save that receptionist a lot of time and frustration if when you visit or when you call, you ask for Jane or John or Mary. They can just put you through and you can get the help that you need. Not everyone can address your concerns in a medical office, and this is very important to know. Complaining to the poor receptionist who has no knowledge or who really has no power to change your situation is only going to frustrate you, and it's going to make the receptionist feel bad. When you have a question, ask who is the right person to help you and ask for a way to contact that person. Whether it's through the portal, whether they can transfer you to a phone line, if there's an email address for questions, find out the easiest way to get to that person. Most importantly, do not complain. Rather than venting and taking the time of somebody who really can't help you, be considerate of your time and their time. When you vent to medical office staff or other healthcare staff, it serves no definite purpose, and it can establish you and your elderly parents as a problem. There is research out there about healthcare bias, and healthcare bias says that the healthcare system and doctors and providers view women as extremely emotional about healthcare situations. And because of that, they believe that women are over exaggerating situations, where men, on the other hand, are more factual. So men are taken more seriously by the healthcare system. As a female caregiver, you don't want to be that emotional person who is seen as over exaggerating situations. You want to be the person who is calm, cool, and collected, and who presents the facts to get what you want. We can all learn from mistakes. The more that you work with medical offices, the more that you will learn from things that go right and things that go wrong. Medical tests and information, they will become lost. You may be given the wrong information, the wrong instructions for an appointment or a procedure. Accept apologies graciously, ask for systems and processes to avoid the error in the future, and make sure that you take those steps to learn. Put processes and procedures in place to address ongoing concerns so that you don't appear to be the complainer or the whiner. Pay attention to every small detail. Confirm where medical test results will be sent. Will they go to your doctor's office? Will you receive a copy? Always call to reconfirm medical appointments the day before. Make apologies when you make a mistake or an error. Being gracious is a two-way street. Mistakes happen in all areas of life, and especially when it comes to medical care, everybody really is just trying to do their best. Good news, you've gotten past the receptionist. You have given your credit card, your ID, your insurance card. You filled out all the paperwork. You made it by that reception desk. The second part of the medical appointment is you're invited into the treatment room. Being in that treatment room allows the medical assistant or a nurse to take vital signs, verify medications, and ask about any changes in health or concerns. This really is where you want to talk about medications, and you can talk a little bit about health concerns, but you want to wait to talk more to the doctor about that. Review the medication list and the over-the-counter supplement list with the medical assistant. She normally is looking at this information on a computer screen and going through it. You want to write down every reading that the medical assistant takes. For example, your parent's temperature, their weight, their blood pressure, their oxygen levels. This can help you start a tracking log to see if it's consistent visit to visit, or if you're comparing it to numbers at home, is it consistent with the numbers at home? While you are waiting for the doctor to show up and that nurse or MA is out of the office, talk to your parent about the list of concerns again so that you can jog their memory about why you're there for the appointment, and also so that you both agree on why you're there. Ask your parent if it's okay for you to answer the doctor's question if your parent forgets or cannot. The goal is to set up this appointment so that you can advocate for your elderly parent without you taking over the appointment. You want your parent talking to that doctor. You know more about the situation for your elderly parent than anybody else. And this is where it's important to recognize this at the medical appointment. When you make suggestions or when you ask a question of the doctor, if you can explain the what and the why in a factual and unemotional way, so that that person that you are talking to understands what you're trying to convey. And I'll use an example of an incident I had with one of my clients who was blind, and the medical assistant was upsetting my client because my client couldn't see what she was doing. So here's what I would say to medical assistants or doctors when I would take that particular client to the appointment, and you can put this in the place of your mom. So my mom, who is nearly blind, will physically resist anybody who touches her because she can't see who you are or what you're trying to do, or if you intend to hurt her. If you approach her, speak first, explain the action that you're going to take before acting so that mom can ask questions and be more likely to cooperate. So it sounds like this. Mrs. Jones, I'm going to draw blood. I know you can't see very well. Do you have a preference for which arm I use? Is it okay if I touch and look at your arms so that we can decide which arm is best? And then before drawing blood, and most nurses will do this, but saying something like, "You're about to feel the stick of the needle, breathe slow, we'll be through this in just a minute." That type of detailed conversation works with elderly parents in all scenarios, even those who have dementia, so that they're not startled by what the person's doing, and so that they can follow along step by step with questions, with the process of the appointment. It does make a big difference. So when the doctor shows up, you're going to reiterate that 555 process. That 15-minute appointment clock starts. You want to exchange pleasantries and say hello, but don't take too much time on that. Don't allow your elderly parent to take the purpose of the appointment off course by too much socializing. Return to the reason for that appointment. Go over that 555 process that you would like to use again. And also explain that you are now attending all appointments with your parent because you realize that mom or dad may not be thorough in explaining concerns. Sometimes they've forgotten information or follow-ups, and you want to make sure that everything the doctor's recommending gets done. The doctor will appreciate that, including prescriptions and recommendations. Doctors really do appreciate caregivers who attend medical appointments. Family caregivers can provide a lot of information about daily life and habits, routines, your observations, and concerns that you may have that your elderly parent may forget to bring up. Make good use of that time by going down that list of concerns and questions that you prepared. Allow your elderly parent to answer the doctor's questions. And if they say anything that's inaccurate or incomplete, ask if you can add to that information. In these situations, in doctor appointments, you do want to be very sensitive to allow your parent to be the star of that appointment. Allow your parent to speak to the doctor directly. Some doctors will try to bypass your parent and talk directly to you. That makes your elderly parent feel ignored. Sometimes they can feel angry. Be sensitive to your interactions with the physician in front of your parent. But do make sure that you have the opportunity to express all of the concerns related to the reason for the appointment. Sometimes I would even go to the extent of handing the doctor the list that I brought to the appointment. In some cases, if I thought the information would be a little sensitive to my parent, I would email concerns through the portal in advance of the appointment, or I would fax them, and I would call the nurse and say, "I faxed a list. Can you make sure the doctor has this? Because I'm bringing a client who may be a little sensitive to discussing this, and I want to make sure that the doctor brings it up so that my client doesn't feel like I'm giving too much information or expressing concerns that aren't valid." So there are ways that you can get your points across without taking that focus off the interaction between your elderly parent and the doctor. So be sensitive to that. It's very important. You want your parents to feel like they are getting the time and attention they deserve and that you are not taking over that medical appointment. Provide facts about symptoms and concerns. When you do this, it makes it easier for the medical provider to help you. Vague information is not helpful. Information, again, presented in an emotional manner can result in that information being viewed as unreliable. Facts include information like, so take out your pens, providing blood pressure or blood sugar readings if you're taking those at home. Examples of temperature changes, specific examples of not feeling well, pain levels, and a pain level is 0 to 10. 0, I have no pain. 10, I'm in excruciating pain. 5 is somewhere in the middle. Provide information about how often a concern happens. Is it every day? Is it once a week? If you can, include the time of day and any other facts that you can gather. Having this information written down on a piece of paper is a good idea so that you have a record, and you can also have the doctor's office make a copy. Then what you want to say is, what other information do you need from me or mom and dad to help us resolve this concern? Because there may be other information in addition to what you've provided that the doctor knows would be helpful. I also recommend, this is my favorite question, you want to write this one down. And this goes for doctor appointments, it goes for anything in life. What other questions should I be asking you that I am not? What other information do you know or are you aware of that might be helpful to this situation? Those questions cover a wide range of information. They give the person that you are working with the opportunity to think about situations and scenarios with other clients that might have not gone the right way because they didn't give that information. It's a great question, a great set of questions to ask. Asking questions, there is no silly question that you could possibly ask at a medical appointment or really in any situation if you don't know the answer. Here are more typical questions asked during a medical appointment when you're investigating the health concerns for an elderly parent. So what follow-ups exist? What questions do you have about prescription medications? About side effects from medications? About options for treatment? Is a medication the only option? Are there other options? Referrals to specialists, physical therapies? Very important question. How does this diagnosis today look in the future? In 6 months or 12 months, in 2 years, in 3 years, if I don't take preventative actions, and how does it look if I take preventative actions? And of course, any other important things you want to or should know. Some offices, as we have discussed, have electronic portals, which means they have medical records, which is why when you're in that appointment, the doctor and the nurse may be constantly typing information into a computer during that visit. That does irritate some people, but it's important so that they can document it right there at the appointment when they're thinking about it instead of doing it later when their memory might not be great. If your parent's doctor's office has electronic medical records, ask if you can have a copy of those visit notes before you leave, even if you have to wait a few minutes to get them. That visit note will provide you with a detailed history of the information discussed during the appointment, and you can also make sure that anything that was discussed is entered. So I can tell you that I have gone to a lot of doctor appointments, and after the appointment, I'll send a question through the portal. And the question usually related to something that the doctor and I discussed. Now, here's always the warning. That portal sometimes goes to the medical assistant. So there have been times when I have sent through a question saying, and I'll give a specific example, but the doctor and I discussed that we would try this. If this didn't work, then we would try option B. If the doctor didn't enter that information into the notes, that medical assistant may come back and say, well, you need to make another appointment for that, or that wasn't discussed. That's when you realize that the person answering your question isn't the doctor. You may then have to go back and say, when I was at the appointment, this was discussed. I'm sorry it's not in the notes. Can you go ask the doctor about this? This is why you taking notes and knowing the name of that MA who came into the appointment, knowing the name of the doctor, obviously that's something that you should know. But the more details that you have from those appointments, the easier it is to get a follow-up done without necessarily having to go back to another doctor appointment. Your notes are invaluable. Write it down. Make sure that it gets into that medical record. So important for getting the care that you want. This comes into the subject of making a list of follow-ups. You want to write down everything that the doctor tells you, all of his responses or her responses to the questions and recommendations during the appointment on that piece of paper in the notebook that you brought to the appointment. And you want to keep an ongoing log of information, whether it's in that notebook, whether you're typing it into notes on a computer. If you get that medical record from the appointment, you can double check to make sure that the weight was entered correctly, the blood pressure, the temperature, the pulse oxygen rate. It's important to make that nurse in the medical office your new best friend. Make everybody in that office your new best friend. Nurses can be very helpful in communicating information from you to the doctor and responding to you with suggestions after you leave that appointment. Before you leave the office, make the next regular follow-up appointment if you can do that. Add that date into your calendar and on your elderly parent's calendar when you get back home. Steps for things to do after the appointment. After the follow-up, if you have follow-ups to do, complete those, write them down, create a system to monitor the changes based on the recommendations of the doctor. So if prescriptions were prescribed, what is the improvement that you're supposed to see? If a physical therapy appointment was made, what are your follow-ups? Are your parents doing the exercises? How are they improving? So get a pen out. I'm going to have you write down some other questions. After the appointment, did you fill any new prescriptions? What were they? How many were there? And did you speak to your elderly parent about the importance of taking those prescriptions? If you set up the medication boxes, did you go get the prescriptions, bring them home, set up the medication boxes? Were there any tests or treatments that you needed to schedule? And if so, did you make the call, or is the treatment center supposed to call you by a certain date? If a certain date, put a mark on your calendar, make sure that you get that phone call. And do you believe that the information offered by the doctor resolved those concerns? Do you have any other follow-ups, like perhaps you are supposed to take the blood pressure of your elderly parents or document blood sugar readings? Are you supposed to enter those in the portal? Are you supposed to fax them to the doctor's office? Good quality notes and documentation will smooth the process for every appointment. You'll actually feel like you are in more control and you're getting better care from your doctor's office. Again, find a way to keep those notes permanent. Put them in a notebook, put them in a folder, type them into the computer. Documenting information is beneficial to managing medical care for elderly parents and for yourself. Having this history is very important if your elderly parent sees multiple physicians or has a health emergency that results in going to the hospital. Very, very important. So as you will see, using a process at a medical appointment ensures better results and better care for elderly parents. Using any type of process that works for you, my 555 process, tracking notes, keeping notes, as you'll see, you're kind of becoming the organizer of elderly care for your elderly parent. You're becoming their memory. You are becoming that person who communicates to the doctor's office staff, and especially in emergency situations and hospitalizations, you have a history of what happened. If you go see another doctor and that doctor says, well, what happened with Dr. Jones? You have a history of what happens. This is so important to coordinating medical care for your elderly parents. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. I will see you in the next webinar.